John. Welcome to our clinic. What's your name?
Rajasthan.
Okay, Rajesh.
Fine.
Okay, so you're experiencing neck pain, correct? Neck pain
Yeah.
and low back pain. Okay, for how long?
Back pain is pretty much 1 year. Neck pain, stiffness in 2-3 days.
Okay, you work out in the gym, yes?
Yes.
Okay, did you injure yourself in the gym or just this came on suddenly? Okay, all right. Did something happen at the gym where you injured yourself? Okay, did you wake up feeling like this? Same? Okay, so what's going on is this. We're looking at his posture right now, face the camera. And he has postural distortion. This is one of the signs of a misalignment, also known as subluxation, okay? Look at his neck, he's tilted to the right. He's got a high shoulder on the left, which is also anterior. He's got an anterior pelvis on the opposite side, so that's a sacral-based posterior on the right. This is posterior, and this is posterior, okay? So he's got a lot of torque going on in the spine, all right? The subluxation symptoms will create this. Postural distortion, decreased range of motion, restriction, muscle spasm, and also pain. The patient says that he experiences pain in his neck as well as his lower back. So this is what's going on with you. You're tilted like this, you're torqued, and you're like that. That's what you look like. This is what he looks like. He should be straighter. And looking at his posture, turn this way. He has rotation in the neck, look straight ahead. He has a slight anterior head carriage. He's got decreased kyphosis in the mid-back, hyperkyphosis in the low back, and the sacrum is also decreased in kyphosis. So this is what he looks like. This is what you look like, sir. You're straight like this, rotated. You've lost your curve, you've lost two curves.
In the lumbar lordosis.
And the lumbar lordosis is hyper. So he's like this. This is what he looks like. He should look like this. This is what he should look like. This is proper posture for weight bearing purposes. So you probably have disc bulges in your lower neck as well as your lower back, okay? So what we're going to do is we're going to perform a chiropractic adjustment and start the correctional process by adjusting your spine, okay? So please lie face down. Okay, down. Now, I'm going to start the palpation process, starting from T1 all the way down the sacrum, and then from C1 down to, actually we're going to start from C1 and go all this way down. Okay, so if you sacral-based posterior on the right, C1 will typically be subluxated right. Okay, so we're going to start. And in fact, he is. Is that tender, sir?
That's the leg? Yes.
Yeah. Now, if C1 is subluxated on the right, then typically C6 will be subluxated on the left. Is that tender? It's tender. So now we come down to C7. T1 is going to be also opposite. So C5 through T2 is going to be subluxated the same side, opposite of the sacral-based posterior. Is that tender? Is that tender? He has complete rotation on the left-hand side. T3, T4, T5. Tender, sir? Okay, T5 on the left. 6, 7, 8, 9. Tender? T9 is tender on the right-hand side. It's the same side as the sacral-based posterior. 10, 11, 12. Tender? L1. Do you experience constipation or diarrhea?
आपको कब्जी रहती है?
Yes, problem.
Yes.
Okay, that's indicative of an L1 subluxation. Tender? Okay, this is L2 on the left-hand side. L5 on the right. L5 on the tender. Okay, so he has issues at L5, which could be lower intestines as well as the reproductive system. And palpating sacrum, he's definitely stuck on the right. He's sacral base posterior on the right. Is that tender right there, sir? Okay. Leg length test, short right leg, sacral base posterior on the right. Now we're going to attempt the chiropractic adjustment and begin the correctional process. I always start the foundation, which is the sacrum, and work my way up to the roof of the house. The house is always to be started on the foundation and then create a new house all the way to the roof, which is C1. So we're going to start the process by using drop table. Contact point is S2, medial of the SI joint on the right hand side. You're going to have a flat contact, ischial tuberosity opposite side, tissue slack out clockwise, straight drop P to A. 3 times. Next, we're going to correct the sacrum by taking the apex, because it's usually posterior, which is at S4. Contact flat hand, tissue slack all the way out. Inferior, you're going to do a 45-degree angle, inferior P to A, just like that. Check the leg length. He's balanced, but he still has a slightly short right leg. So now what we're going to do is a side posturing. This is a diversified type technique. This side down, this side up. Right side lower, left side up.
उनकी तरफ है।
On your side. Okay. Come towards me. Okay, in this instance, he's got very, very tight quadriceps. So I'll take his leg off the table. Relax your upper body, relax your lower body. Contact point is S2. Flat hand contact. It's going to be a quick thrust, P to A, clockwise maneuver. Just like that. At times you'll hear an audible, sometimes you won't hear an audible. In this case, we did not. Okay, so now we're going to take care of the AS component. So left side lower.
Relax, tightening.
Okay, leg off the table. Once again, his quadriceps are very tight. Ischial tuberosity, contact point. It's a straight down maneuver. Okay, and we've got a slight audible there. Now, he has anteriors because he has a hypokyphotic thoracic spine. We're going to take him to another table now. We're going to do another type of technique. Come with me, sir. Okay, I want you to sit like this. Okay? Back up. Okay. Have the patient cross his arms. Now, he had T9 subluxation. You're going to go to T10 and tissue slack up to T9. And then ask the patient to breathe out, and it's just a quick A to P thrust. And he already went as we went down. Next we have T5. So the T6, tissue slack out, quick A to P thrust. And he went. Okay, now, head in the slot please. Now we're heading towards the roof of the house. He had C6 on the left, C1 on the right. I'm going to repalpate to check if in fact that's the case. So when you palpate the neck, you palpate at the lamina. And in fact, C6 is out of alignment. So now what I'm going to do is adjust. You take tissue, lamina contact, take tissue slack out, lateral bend all the way to end plate, quick thrust. Nice simple adjustment. Go up to C1. In fact, he is subluxated on the right. Now, contact the lateral mass. It's just going to be a straight lateral thrust, just like that. Okay, sir, come on up.
Get up. You need this to walk.
I'm going to ask the patient to walk and check his posture. Walk this way. Okay. All right, back up, please. I want you to stand right here and face the camera. Okay, now let's take a look at his posture. What an improvement. I mean, he's almost straight with his neck. He doesn't have much rotation. Shoulders are even. Even the shoulder's gone posterior. This has gone posterior. He's even, he's balanced. So he has about a 70% postural improvement based on chiropractic adjustments. Congratulations, just had your very first chiropractic adjustment. Okay?
That's really easy.
Good.